Did you know that hidden inflammation inside your arteries could be silently setting you up for a heart attack right now, even if your cholesterol numbers look perfectly normal? This invisible threat builds quietly within your blood vessel walls, increasing clot formation and causing damage without any warning signs. Most people walk around completely unaware that their arteries are under attack from the inside. Here's the truth that might surprise you. Artery inflammation is one of the leading reasons people experience heart attacks, and it happens to individuals whose cholesterol levels appear healthy on paper. The inflammation creeps through your cardiovascular system like a silent intruder, raising your risk day by day. But there's genuinely good news that can change everything for your heart health and longevity. Beyond essential lifestyle modifications, targeted supplementation can help reduce inflammation in meaningful, measurable ways that directly lower your heart attack risk. Scientific research has identified specific natural compounds that support your body's ability to calm inflammatory responses and protect arterial health. These aren't random suggestions, but evidence-backed interventions studied in real people with real results. In this video, I'm walking you through 7 of the most thoroughly researched and powerful supplements you need to know about for cardiovascular protection. Many of these compounds might be completely new to you, and the last one is so commonly misunderstood that most people use it entirely wrong. I'm also giving you free access to a comprehensive resource that brings everything together for practical application. If you find this information valuable and potentially life-saving, please hit that like button, share this video with someone who needs to hear it, and drop a comment below about your own heart health journey. Your engagement helps us reach more people who could benefit from this science-backed approach. Now let's dive into these 7 inflammation-fighting supplements that could transform your cardiovascular health. Let me share a story about someone in their late 50s who had been diligently working on improving their health markers. This individual cleaned up their eating patterns, committed to daily walking routines, and prioritized better sleep quality. Blood pressure readings had decreased nicely, cholesterol panels were showing positive trends, and overall health metrics appeared encouraging on the surface. However, one critical marker remained stubbornly elevated despite all these positive changes. Inflammation levels measured through comprehensive blood testing. The panel included C-reactive protein, commonly abbreviated as CRP, which serves as a key indicator of inflammatory processes occurring throughout the body. This marker reveals hidden inflammation that you absolutely cannot feel, but silently damages your cardiovascular system over time. The elevated CRP levels signaled that the body remained under significant internal stress even though external health markers looked good. This type of concealed inflammation substantially increases heart disease risk and contributes to various cardiac complications over the long term. The situation clearly indicated the need for additional support, something capable of directly addressing and calming the inflammatory response at its source.
A natural supplement with extensive clinical research for this exact purpose was added to the health protocol. This compound helps lower systemic inflammation, supports healthy blood circulation patterns, and can even improve cholesterol profiles simultaneously. It functions by helping the body quiet down the inflammatory signals that otherwise remain active for too long, creating cumulative damage. Multiple clinical studies conducted with actual human participants, not laboratory animals or test tubes, demonstrated this supplement's effectiveness. Research showed it helps lower CRP levels by approximately 1 point on average, which might not sound dramatic to non-medical people. However, even half a point reduction or a quarter point decrease represents a big deal in cardiovascular risk reduction and long-term heart health outcomes. The studies were methodologically sound and showed consistent, reliable results over 8 to 12-week periods, particularly in individuals with existing heart risk factors or elevated inflammation markers. The supplement producing these impressive results was aged garlic extract, typically used in doses between 600 to 1,200 milligrams daily. This form is easier for your digestive system to absorb, gentler on stomach tissue, and highly effective. After 3 months of consistent supplementation combined with ongoing lifestyle improvements, the inflammation marker dropped significantly, and health trajectory moved in the right direction. This real-world example demonstrates how targeted supplementation supports the body's natural healing processes. Now let's move to the second powerful supplement that addresses both inflammation and problematic blood fat levels simultaneously. Consider someone who recently recovered from a cardiac event and made substantial dietary changes by eliminating sugar and following medical guidance carefully. Blood pressure and cholesterol measurements were steadily improving, showing positive response to lifestyle modifications. However, triglycerides, a specific type of blood fat, remained elevated beyond the healthy range despite these efforts and commitment to change. Blood work analysis revealed elevated CRP along with several other inflammatory markers from the comprehensive panel used to assess systemic inflammation. This individual preferred not to include fish in their regular diet due to personal taste preferences. They remained open to natural supplementation options that could address both inflammation and triglyceride concerns without requiring further dietary modifications beyond what they'd already implemented. A supplement with decades of research and extensive studies in people with cardiovascular disease was added to address this dual challenge. This compound works by calming overactive immune responses and helping balance fat levels circulating in the bloodstream. A recent clinical trial published this year studied people recovering from cardiac events and measured their inflammatory responses over time with careful monitoring. Study participants taking the supplement experienced CRP reductions of 1.54 compared to 0.92 in the control group receiving placebo. Remember that even half a point improvement in CRP represents significant cardiovascular benefit. Everyone in the study showed improvement post-cardiac event, but those taking this particular supplement demonstrated substantially better inflammatory reduction.
They also experienced improvements in various blood fat profiles and metabolic markers related to cardiovascular health. The study design was rigorous, including placebo-control groups and blinded researchers, meeting all criteria for reliable scientific evidence. The supplement delivering these results was omega-3 fatty acids, specifically the important forms called EPA and DHA, found concentrated in quality fish oils. Yes, debates exist about optimal ratios, safety concerns, and differences between fish-derived versus plant-based omega-3 sources. However, regardless of which side of these detailed debates you find yourself on, the fundamental truth remains. Omega-3 fatty acids help most people and demonstrate safety in the vast majority of individuals. Most effective studies use between 1 and 3 grams daily in concentrated capsule form. This supplementation proved safe when taken with food and provided powerful support for lowering inflammation and improving overall heart health markers. After approximately 6 weeks, triglyceride levels had decreased and CRP was no longer in the high-risk range. The supplement wasn't the only factor contributing to improvement, but it clearly made a measurable difference while fitting perfectly into this person's lifestyle preferences and requirements. Moving to our third inflammation-fighting supplement, let me tell you about someone in their early 60s working hard to improve overall health status. They'd received a metabolic syndrome diagnosis characterized by elevated blood sugar, increasing waist circumference, and rising blood pressure readings. After implementing steady dietary changes and establishing daily walking habits, energy improved, and weight started decreasing gradually but consistently. Despite these positive changes, concern remained about cholesterol levels, particularly LDL, often called bad cholesterol, due to its role in arterial disease. Online research had introduced the concept of oxidized LDL, a modified form of cholesterol theoretically more likely to adhere to artery walls. The science around oxidized LDL continues evolving and remains somewhat weak, so excessive focus on this specific marker isn't typically warranted in clinical practice. However, this concern motivated positive action and health engagement, which represents genuine value regardless of the specific biomarker focus. A supplement discovered through independent research was brought to a medical consultation to discuss its potential benefits.
Examining the evidence together revealed interesting findings from well-designed studies showing people with metabolic syndrome who took this supplement daily experienced drops in total cholesterol, LDL, and CRP. The most substantial changes occurred in individuals who already had higher cardiovascular risk profiles at baseline, making the intervention particularly relevant. Another strong study demonstrated that overweight adults taking 150 milligrams daily for 6 weeks showed reduction in oxidized LDL, supporting healthier arterial function. The study also revealed small but meaningful improvements in blood pressure measurements. While this particular study didn't show dramatic CRP changes, the antioxidant effects were clear and clinically relevant. Both studies were double-blind and placebo-controlled, with results proven reliable and not based on researcher bias or guesswork. The supplement in question was quercetin, a plant compound you may have heard more about in recent years due to emerging research.
Most studies utilize 150 to 500 milligrams daily, typically taken with meals, to minimize potential stomach upset. Quercetin is generally well tolerated, especially when integrated as part of a comprehensive metabolic health improvement plan. After 6 weeks of consistent use, oxidized LDL levels dropped, blood pressure improved, and overall cholesterol numbers began trending toward healthier ranges consistently. These biomarker improvements weren't dramatic overnight transformations, but provided confidence and supported ongoing lifestyle work already in progress. This positive reinforcement helped maintain motivation for continued healthy habit implementation and further lifestyle modifications. Now let's explore the fourth supplement, which addresses inflammation through a different but equally important pathway for cardiovascular protection. Someone age 67 sought medical guidance specifically to lower heart attack risk after their sibling experienced one the previous year. This frightening family experience created genuine motivation to avoid similar cardiovascular events. Blood pressure was slightly elevated, cholesterol remained borderline, and CRP exceeded the ideal range, but they preferred avoiding statin medications or other long-term pharmaceutical interventions. Natural methods with solid scientific backing were the preferred approach for supporting heart health and reducing cardiovascular risk. Daily walking was already established, dietary improvements were underway, but high-intensity interval training and resistance training hadn't yet been incorporated. Movement was progressing in that direction gradually. Focus turned to inflammation because hidden inflammatory processes inside blood vessels represent one of the biggest drivers of heart disease. A natural compound extensively studied in human trials for cardiovascular effects has been shown to lower both CRP and TNF-alpha, both markers tied to arterial inflammation. This supplement also demonstrates mild antiplatelet effects, which benefits cardiovascular health because smooth blood flow is crucial. The final common pathway causing heart attacks isn't primarily the plaque itself, but unstable plaque, triggering dangerous clot formation. Unstable plaque can trigger clots that, if large enough and traveling to the heart, cause heart attacks, or if reaching the brain, cause strokes. Even tiny microscopic clots that don't cause immediate heart attacks or strokes can continuously rain down on heart or brain tissue, creating microscopic damage patterns. This leads to heart muscle damage, brain tissue deterioration, heart failure, cognitive decline, and increased Alzheimer's risk over time. Multiple studies involving people with cardiovascular risk who use this supplement for 8 to 12 weeks demonstrated improvements in inflammation markers and enhanced circulation patterns. Results proved most consistent in individuals managing early-stage cardiovascular risk, exactly matching this clinical situation. The supplement producing these benefits was ginger extract, with most studies using between 700 and 2,000 milligrams daily. Typically administered in capsule or concentrated extract form, ginger is generally safe and well tolerated, particularly when consumed with meals. After several months, CRP levels decreased noticeably, and unexpectedly, knee stiffness improved significantly. Usual after-meal digestive discomfort disappeared entirely, creating multiple quality-of-life improvements beyond the primary cardiovascular goal of inflammation reduction.
Without proper medical support and guidance, attempting to navigate supplement protocols represents genuine risk to your health and well-being. This isn't a do-it-yourself situation when your life, health, and family depend on making correct decisions. Unfortunately, Fewer than 0.5% of physicians receive specialty training in preventative medicine, with most acquiring knowledge informally through experience rather than formal education. Even more concerning, 3/4 of doctors cannot properly diagnose prediabetes or metabolic disease, representing huge gaps in preventative care. Finding preventative medicine-trained physicians presents real challenges for patients seeking proactive cardiovascular care. A team of clinical advisors receives personal training and works collaboratively daily to help lower risk and prevent heart attacks using lifestyle-first approaches combined with targeted interventions. If you're ready to take that next step toward comprehensive cardiovascular protection, resources and contact information are available in the description below. Even if you're not ready for that level of commitment right now, please download the free Comprehensive Heart Attack Prevention Protocol. This information is crucial because your current physician likely doesn't know it, and you need these insights for better informed conversations. The fifth supplement emerged from helping someone age 64 struggling with disrupted sleep patterns and daytime tension. They weren't experiencing clinical anxiety, but felt constantly on edge throughout the day. Sleep aids were not an option because while they may provide short-term relief, they ultimately make sleep problems worse long-term, creating dependency and rebound insomnia patterns. A supplement was started primarily to help muscles relax and support better sleep quality without pharmaceutical intervention. Nothing else changed during this period, with diet, physical activity levels, and other medications remaining constant. When blood work was repeated several months later, the CRP that had been elevated along with other inflammation panel markers was back in the normal, healthy range, significantly reducing long-term cardiovascular disease risk. The inflammation had improved substantially, and the only intervention introduced was this single supplement. It hadn't been taken specifically for inflammation management, but ended up helping that critical marker significantly. Good quality sleep genuinely helps reduce systemic inflammation through multiple biological pathways related to immune function and cellular repair processes that occur during deep sleep stages. Research data confirmed what was observed clinically, with well-designed studies showing people taking this supplement experienced CRP drops of approximately 1.33 milligrams per liter. That represents a huge cardiovascular benefit with significant risk reduction implications. Results were most notable in individuals who had elevated inflammation at baseline, and benefits weren't tied to specific dosing or duration. The effect appeared consistently across different study populations and held up even when data were analyzed multiple different ways, making findings highly reliable. The supplement started without inflammation considerations was magnesium in the glycinate form. Most studies use 200 to 400 milligrams of magnesium glycinate daily, though requirements vary by specific magnesium type used.
Only 2 types of magnesium are recommended: magnesium glycinate and magnesium threonate, both gentle on digestion and beneficial for multiple metabolic functions. Magnesium glycinate is particularly gentle and commonly used to support sleep quality, stress management, and muscle recovery. This supplement remained in the routine because sleep had improved, but now inflammation reduction provided another compelling reason for continued use. Our 6th supplement comes from helping someone aged 59 who had followed a low-carbohydrate dietary approach for the past year. They'd lost over 20 pounds, blood pressure had decreased, cholesterol was moving in the right direction, and overall well-being had improved substantially. Heart health was finally progressing positively, but during a routine checkup, a request came for help with persistent joint discomfort. Weight loss had helped somewhat, but knees and hands still felt sore after exercise sessions or long workdays. Reliance on pain relievers wasn't desired, which was wise because those medications can create long-term problems despite short-term relief. A natural option was needed that could address inflammation, specifically in joints, without pharmaceutical side effects or dependency issues. A supplement known for anti-inflammatory properties, especially for joint health, was already familiar from use with multiple patients successfully. It was added to the daily routine while everything else remained unchanged. Diet,
activity patterns, and medications all stayed constant. Several months later, repeated laboratory work revealed that C-reactive protein, the inflammation marker discussed throughout, had improved dramatically from slightly elevated to well within healthy range. Here's the scientific evidence supporting this supplement's effectiveness. A large review analyzing 23 clinical trials showed this supplement reduced CRP by an average of 3.67 compared to placebo groups. Those numbers represent huge cardiovascular and overall health benefits that translate to real risk reduction. It worked especially well in people with higher baseline inflammation or existing cardiovascular risk factors. Studies were consistent across different patient types and research designs, making the evidence strong and highly reliable for clinical application. The supplement started for joint concerns was curcumin, the active ingredient extracted from turmeric that you've probably heard about. Most studies use half a gram to a full gram daily, 500 to 1,000 milligrams, often in forms that improve absorption, like curcumin paired with black pepper extract.
It's usually well tolerated and supports both joint comfort and systemic inflammation reduction throughout the body. When taken consistently, knees no longer bothered after long walks, achieving the primary goal. Even better, laboratory work showed inflammation had decreased and heart health continued moving in the right direction. Joint comfort and cardiovascular protection from one well-researched natural compound.
Cholesterol and blood pressure held steady, and overall health appeared better on laboratory reports. However, a carotid ultrasound scan, a simple radiation-free test examining plaque in neck arteries, revealed unexpected findings. Early plaque buildup was visible in the arteries, not severe, but serious enough to warrant immediate attention. Understanding that you only need small amounts of plaque to cause heart attacks or strokes is critical. Most people incorrectly think you need extensive plaque that blocks arterial flow before risk becomes serious. The truth is that more heart attacks and strokes result from small amounts of unstable plaque than from severely blocked arteries. Why? Because far more people have small plaque amounts, and that's sufficient to cause catastrophic cardiovascular events when plaque becomes unstable. Blood work made the situation clearer. CRP, interleukin-6, and TNF-alpha were all elevated, indicating immune system damage to arterial linings occurring without any felt symptoms but measurably present. A low-dose statin was recommended not for cholesterol reduction, but for inflammation management. The recommendation was declined based on concerns heard about statins, with preference for trying other options first before pharmaceutical intervention. Inflammation tracking continued, and the problem didn't resolve with lifestyle changes alone. Another option discussed was low-dose colchicine, a medication used traditionally for gout that can cause side effects but has been found in very low doses to reduce cardiovascular inflammation and disease risk. Again, the answer was no, not from lack of trust in science or medical advice, but from desire to exhaust natural options first. A supplement working on the same inflammation markers, but through different biological pathways, was the next logical step. A 2023 meta-analysis reviewing several high-quality clinical trials, representing one of the highest forms of scientific evidence, found this supplement significantly lowered CRP, interleukin-6, and TNF-alpha in people with elevated cardiovascular risk. Results were strongest in people with higher baseline inflammation. Benefits were dose-dependent, appearing most clearly after 12 weeks or longer of consistent supplementation. It was added to the daily routine with nothing else changed. 3 months later, CRP was lower, energy had improved, sleep quality was better, and there was a renewed sense of being back in control. The supplement was coenzyme Q10, also available as ubiquinol, another effective form. Most studies use 100 to 200 milligrams of CoQ10 daily, especially in people with inflammation or arterial plaque buildup. It's well tolerated and supports inflammation control, arterial health, and cellular energy production. Here's what most people misunderstand. They think CoQ10 is only useful when taking statins because it's been paired with those medications historically, since statins can deplete CoQ10. People incorrectly believe it's just for preventing muscle pain associated with statin use. The truth is you don't need to be on statins or any medications to benefit substantially from CoQ10 supplementation. If you have arterial plaque, elevated inflammation, or cardiovascular risk factors, CoQ10 can help powerfully on its own without any other medications or interventions required.
But here's the biggest mistake people make with all these supplements: relying on them alone without lifestyle changes. This represents a huge error in thinking. There is absolutely no supplement, regardless of how well researched, that will fix lifestyle problems. You cannot out-supplement poor lifestyle choices, period. Supplements are tools, not magic solutions that work independently of your daily habits. They work best when integrated as part of a bigger comprehensive plan, including regular movement, quality nutrition, adequate sleep, effective stress management, and genuine consistency over time. Please use supplements wisely as support for the progress you're already making through lifestyle improvements, not as replacements for fundamental healthy living. Visceral fat represents one of the major hidden culprits driving cardiovascular inflammation that supplements cannot address alone. Understanding how inflammation silently damages your cardiovascular system represents the first crucial step toward protecting your heart and extending your healthy years. The 7 supplements we've explored today, aged garlic extract, omega-3 fatty acids, quercetin, ginger, magnesium glycinate, curcumin, and coenzyme Q10, all have substantial scientific evidence supporting their inflammation-reducing effects and cardiovascular benefits when used properly. Each of these natural compounds works through different biological pathways to calm inflammatory responses, support healthy blood flow, and protect your arteries from ongoing damage. The real-world examples shared demonstrate how these supplements, when combined with fundamental lifestyle improvements, create measurable positive changes in critical health markers. Remember that supplements enhance and support your healthy lifestyle choices, but never replace them. Your cardiovascular health depends on a comprehensive approach that includes quality nutrition, regular physical activity, adequate sleep, effective stress management, and consistency over time. Supplements provide that additional support to help your body function optimally and reduce inflammation more effectively. The evidence is clear, the benefits are real, and the applications are practical when done correctly with proper guidance. If you found this video helpful and potentially life-saving for yourself or someone you care about, please show your support by hitting that like button right now. Subscribing to this channel ensures you'll receive more evidence-based health information that empowers you to take control of your well-being. Share this video with friends, family members, or colleagues who could benefit from understanding how to protect their heart health naturally. Drop a comment below sharing your thoughts on these supplements or your own experiences with inflammation and cardiovascular health. What surprised you most about the information shared today? Have you tried any of these supplements, and what were your results? Your comments create community and help others learn from shared experiences, so please take a moment to contribute to the conversation happening here. Remember to download the free comprehensive heart attack prevention protocol available in the description below for additional guidance and actionable steps. Your heart health is too important to leave to chance, and having the right information empowers better conversations with your healthcare providers. Thank you for investing this time in your health, and I'll see you in the next video with more science-backed strategies for living your healthiest life.